You are tuning in to Living Mentally Well with Kevin Hines. Follow us as we interview some of the greatest, most influential minds and public figures in the fields of suicide prevention, entertainment, activism, mental and behavioral health. We welcome you to listen, learn, watch, and enjoy. And the great John Draper, the man himself. John, can you tell us a little bit about the work you're doing in the field, highlight some aspects of the work you're doing in the field of suicide prevention? Go.
I have the distinct privilege of being able to administer a national network of crisis hotlines that really do the work in local communities around the country. It's basically one number that people can call anytime from anywhere in the United States and get connected to somebody who's trained and can help them. Somebody who could be at suicide risk, who's in emotional crisis, anything that's troubling a person, they can call this number and get them help. So my job, my privilege, is to be a part of this national effort to reduce suicide by connecting people easily to help whenever they need it.
That's amazing, impactful, and imperative. John, what do the term mental wellness mean to you?
Mental wellness means that a person is able to pursue what's important to them in their life. That there's something that they can think, they can plan, and they can execute that which is important to them. It could be work, it could be relationships, it could be all the above. But anything that in some way, whether your thoughts or your behavior, your feelings, if that stands in the way of you being able to accomplish something that's important and meaningful to you, then you need to do more for your mental wellness. So being aware of what you need and what you want and what's hindering you may start with you. So what can you do to help yourself or get help from others to help you be more mentally well?
Yes, absolutely. What can you do every day to stabilize, to stay well, to stay above water? Okay, Dr. Draper, I want to know what is one thing or one idea, one thing you do every day, or regularly at least, to better your mental health.
More than one thing.
I know.
There's a lot of things. For one, the work I do is very meaningful. So just engaging in the work and the people around that makes me feel connected, like I belong to something that's important. But I also have some wonderful family, some wonderful friends that I stay in contact with. Whether it's if I'm out of town, it's by text or it's by phone. But always making sure that these are people in my life and I let them into my life, because I think we all have people, but sometimes we forget that we've got to reach out and put effort into our relationships. So that's one thing that I'm constantly reminding myself of, is like, I don't feel like talking right now. I need to talk right now.
Interpersonal connections can save lives, right, John?
Amen to that.
John, Dr. John Draper, where do you want to see suicide prevention and mental health space in the next 5 to 10 years?
Well, I'd like to see suicide prevention integrated into all mental health work, and I would like to see all mental health work integrated into health. So when we're going to see our doctor, they're mindful of our mental health and whether or not we're safe and taking care of ourselves and not doing things that are putting us and others at risk. So the closer, it's really about meaningfulness, and it's about health. And so if I am going to my doctor, it's important that it's not just about my health, but also about my overall health. So are there any stresses in your life? How are things going in your relationships? And I know they don't have a lot of time, but they can also use their support staff, and they should have behavioral health care staff also on staff available to them. So all of that should be available to us. That's what I'd like to see, but ultimately what I'd really like to see is all of that have an impact where the suicide rate is reduced at least by 20%, and one day, perhaps, close to zero.
If we work hard enough in this field, in this space, it will happen. It must. It has to. And all of us will keep going in this field until we get to that place.
So glad to be with us to make that
you
happen.
betcha. Thank you very much, Dr. Draper. Appreciate it. All right. This has been Living Mentally Well with Kevin Hines, brought to you by 17th and Montgomery Productions. Thank you for tuning in. Subscribe below and let us know the thoughts you have in the comment section. Everyone has a story. We want to hear yours because you matter.